COVID cases are rising and emergency rooms in the Midstate are very crowded. How crowded? Well, one hospital has doctors seeing patients in the waiting room. Kayla Schmidt reports.
It's not secret. Midstate hospitals are crowded right now. Very crowded. So what happens if a time comes that no emergency room beds are open, but people need care? UPMC says
when we're short on beds in the ED, we actually bring the providers to the front of the house. So I worked yesterday. I was seeing patients actually the last 4 days, and I provided care in the waiting room.
UPMC Chair of Emergency Medicine, Dr. Anthony Guarasino, says at the start of the pandemic, people were hesitant to visit emergency rooms. That's changed, and a lot of those people seem to be showing up at once.
Surgeries were canceled, people postponed routine medical care, and unfortunately now they're paying the price.
Now he says the ER is becoming a place people use for problems that aren't always urgent, and people who need the care are having to wait longer.
What we're experiencing right now really is unprecedented, even by, shall I say, previous COVID experiences.
Dr. Peter Dillon, Chief Medical Officer from Penn State Health, says all ERs are being challenged by the number of patients needing care. What's critical is ensuring patients who really need the care can get it.
And that does involve, if necessary, having physicians or advanced practice clinicians go out into the waiting area to facilitate that.
Neither health system says it's had to turn away patients, but Dr. Dillon says Penn State has had to divert some patients based on the level of their emergency.
However, that does not apply to those types of acute medical and surgical events that need to be evaluated and seen.
His advice: get vaccinated and go over all symptoms with your primary care doctor before deciding whether to go to the ER if it's not an emergency. Kayla Schmidt, ABC 27 News.